not good posture while speaking. All of those add strain to the voice and we overuse it. So, dapat careful po tayo, we use it properly.
Yung mga causes kasi of hearing loss, it varies yan per age. So sa mga bata, ang most common kasi is yung ear infection na tinatawag.
Our ears, our nose, and our throat are vital parts of our bodies that we use on a daily basis. While they may function differently, they are all interconnected. If one is at risk of an infection or even damage, it may affect the other two as well. That's why it's important in understanding how they work together, which can help you best care for your E, your N, and your T. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk. Our ears, specifically our ability to hear and understand words, is such a vital role in our daily lives. Now here to tell us kung paano natin mapapanatili ang health ng ating pandinig, we have with us Llewellyn Llamas, who is a certified audiologist. Ngayon, Bing, pagdating sa pandinig ng mga tao, ano ba yung mga more common causes, lalong-lalo na sa mga Filipinos, why some people suffer from hearing loss or decrease in hearing?
Okay po. Bali, Doc, yung mga causes kasi of hearing loss, it varies yan per age. So, sa mga bata, ang most common kasi is yung ear infection na tinatawag. And then for adults naman, we have what we call yung noise-induced hearing loss. And then we also have yung presbycusis or yung age-related hearing loss. And as simple as earwax blockage can cause a temporary hearing loss din po.
Itong sinasabi mong noise-induced hearing loss, meron bang mga trabaho na mas prone sa decrease in hearing or even hearing loss?
Actually, Doc, meron po, no? So, yung mga construction workers natin, and then even our seafarers, yan, kasi exposed din sila sa ingay. And then, yung mga people na nag-work sa mga bars and yung mga certain places na talagang malalakas yung mga background noise na nakukuha nila.
Paano naman, Bing, yung mga kabataan ngayon, yung mga mahilig maglagay ng mga earphones, lalo ng matagal, nakikinig sila with music or videos or whatnot, na yung volume minsan pataas ng pataas. What can you say about this?
Yes po, Doc. Actually, ngayon, with certain age kasi, yung mga bata, mahilig na silang mag-headphones talaga. So, kapag sila, napapansin nila na nagli-leak na yung sounds dun sa mga kasama nila sa paligid, it means na sobrang lakas na nung volume na pinapakinggan nila. And this certain volume, it might cause a noise-induced hearing loss din in the long run. So, as early as kahit bata pa, kapag exposed na sa mga noise na ganyan, at risk din po sila.
Okay, and you also mentioned, Bing, ang presbycusis. Presbycusis is hearing loss based on age, based on a natural decline of someone's hearing, ano? Now, how can someone see presbycusis symptom-wise? Paano nila ito makikita in real life?
Actually po, if meron kayong mga kamag-anak na nasa older generation, so tita, lolo, or lolo, and then if they repeatedly ask you na pakiulit yung sinasabi ninyo, or alam naman nila na kinakausap sila pero hindi nila maintindihan, those are the telling signs na baka meron na silang condition na presbycusis.
Okay, this is actually very important because like what you said, no, people in the older generation who ask, ano nga yung sinabi mo? Let's not assume right away na hindi sila nakakarinig, baka hindi lang nila maintindihan. So let's differentiate that. Someone who is able to hear and someone ang hindi lang naintindihan ang sinasabing mga salita. And one way to be able to isolate this is with a hearing test, which you do quite often dito. Explain natin sa mga viewers kung ano ang benefits or ano ba talaga ang hearing test.
Okay. So, ang hearing test natin, it varies kasi with the age of the patient. So, kapag bata, iba rin yung test nila. Pero mostly kapag adult, it is divided into 3 tests. So, meron tayong pure tone audiometry na tinatawag. And then with this test, meron lang silang certain sounds, clicks or tones na maririnig. And all they have to do is raise their hand or click a button if marinig nila yung softest sound. And then next po is yung speech audiometry. So meron lang akong mga certain sounds or mga words na sasabihin sa kanila and all they have to do is repeat yung word na kapag narinig nila. And then for the last one is yung tympanometry. for us to know kung ano na yung status ng kanilang middle ear.
Okay, balik tayo ng konti. Bing, you also mentioned how the test for children is also different of that of adults. Napaka-importante bang malaman at an early age kung ang isang bata ay may problema sa pandinig? How does this affect a child later on in life?
Opo, actually, ang bata kasi, meron lang tayong certain window for them, no, for their speech and language development. So kapag napansin nung parent na halimbawa, hindi nagugulat yung bata kapag may malakas na tunog or kapag nakailang tawag na yung pangalan and then hindi siya lumilingon, and then kapag mapansin nila, most probably at the age of 4, kung hindi pa clear yung speech ng bata or medyo bulol pa, these are the signs na kailangan mapatingnan na yung bata.
Okay.
Opo.
Okay, so importante yun. Ngayon, balik na tayo doon sa mga may presbycusis. Ano ang pinakamagandang way or what is a good way to address the problem of presbycusis?
Okay, so right now we have what we call yung mga hearing aids para matulungan yung mga ating elderly sa presbycusis conditions nila.
Okay, now hearing aids, parang this is a very important tool for audiologists and for ENTs as well to improve the quality of life ng mga taong may problema sa pandinig. Ngayon, mahal ba ito, Bing? I'm sure it is an investment for a lot of people. Pero bakit? Anong mga benepisyo ito that may outweigh the probable investment or the cost with this?
Okay. To be honest po, talagang merong kamahalan din talaga ang mga ibang hearing aids kasi it depends on the features na makukuha doon sa hearing aids. Pero ang hearing aids kasi natin, it is an investment, okay? Although hindi niya magagamot yung hearing loss na nawala, it will help the symptoms. So it will help the wearer na mas maintindihan ng mabuti yung mga kausap niya sa paligid.
Napakagandang information talaga yan, Bing, lalo na sa mga viewers natin who are not aware of the benefits of a good fitting hearing aid. Do you have any message for our viewers?
Okay, so if you or your loved ones are experiencing any symptoms of hearing loss, maganda talaga kung makapagpatingin na kaagad sa iyong ENT at audiologist kasi early identification always leads to good outcome.
Nako, napakaganda talaga ng message, Bing. Thank you so much for joining us and sharing your expertise with our viewers about how to preserve one's hearing. So we've been talking about hearing and our ears will continue to talk about that and how the nose and the throat are all integrated. Stay tuned with MedTalk Health Talk. We'll be right back. Welcome back to MedTalk Health Talk. Your ears, your nose, and your throat are all interconnected. To tell us more about how all of these are interconnected and how important it is to have them functioning properly, we are joined today by Dr. Maria Lourdes Enecilia, who's an otorhinolaryngologist or an ENT head and neck surgeon who specializes in rhinology, and she's from St. Luke's Medical Center. We have a lot to cover. Let's talk about our ears. A lot of people know that our ears are responsible for hearing. Kaya napaka-importante dyan is how do we take care of our ears? Let's start with proper cleaning. Umpisa natin, lahat tayo naliligo, pero maraming tao dyan ang hindi kompleto ang pagligo kung hindi nilinis ang tenga with some form of cotton buds. Tama ba ito, Dr. Mari? Paggamit ang cotton buds, paglinis ng tenga?
No, I would like to discourage everyone from using cotton buds too much. In fact, the manufacturer said it's not supposed to be used in the ear, the original manufacturers. Our ear has its own self-cleaning mechanism. So what you do lang po after you take a bath, wrap your finger na towel, wipe outside. There's no reason to go deep inside because pwede pa pong mabutas yung eardrum and that will cause more damage. So wala pong dapat pinapasok sa loob ng
Okay, so
tenga.
paano yung Dr. Mari? Pag hindi dapat nililinis ang tenga, actually, it has its own self-cleaning mechanism.
Yes.
Paano pag merong naipon na dumi dyan? Paano nila tatanggalin yon?
Well, for that, kung meron po talagang naiwan, then they can see their ENT for proper ear cleaning. But usually, for most of my patients, if they don't use the cotton buds too much, it doesn't happen.
A lot of people are aware that our ears are responsible for hearing, but not that many people know that our ears are also responsible for our balance. Now,
Yes.
it's a very complicated process. We don't have enough time to explain the complexity of that. Pero, Doc Mari, what are some of the red flags kapag kailangan how should our viewers know that kailangan na magpatingin sa ENT pag may balance problem?
All right. So one very classic description of a problem in balance is because of the ears is yung when they turn their heads or when they lie down or stand up, they have this really bad spinning sensation, as in umiikot parang sa roller coaster. But most of the time, it lasts only a few seconds. Sometimes it's related to lack of sleep, not certain things in our diet, too much salt, not enough water. So if it goes away, then okay. But if it keeps happening, time to see your ENT.
Okay, ito yung tinatawag na vertigo.
Yes.
Okay, now moving on from our ears, let's talk about our nose. Kasi meron din connection ang ears natin sa ating ilong. Could you talk about that really briefly?
Yes. So, behind our eardrum, there's an air pocket. Okay? Yung pag sa airplano, di ba? Minsan pag umaakyat, parang nabibingi tayo. And that's because may natatrap na air. But when we swallow, or they say you swallow or you drink, biglang nawawala. That's because the air goes into the nose. There's a connection. Kaya lang, sometimes when we have sipon or barado ilong, we also feel na blocked din ang ear. So that's how they're connected. So we have to take care of both the ear and the nose.
Okay, nang pag-usapan naman natin ang sipon o pagbara ng ilong because some people, it happens more often than others. Pag-usapan natin yung mga madalas nangyayari ito. Could this be a sign of an allergic reaction?
Yes, there's about 20% of the population are very sensitive to certain things in the air. Usually before age of 20, ganyan na sila. They sneeze all the time, 5 to 10 times in the morning, and then they have sipon and their nose is blocked the whole day na. Pag ganun, if it's every day or almost every week, they should see an ENT already for treatment.
Now, when it comes to us being able to tolerate, marami sa ating mga viewers, kakayanin nila ang pagbara ng ilong kasi kaya pa naman nila. Is this something that should be in the mindset of our viewers? Kung kaya pa naman, wag na magpatingin muna sa doktor.
It's more of the regularity, no? Yun nga yung kung every day or 3 times a day, every week, they should see an ENT. Even they say, I've had this since I was 5 years old and they're 20-something. They should see an ENT because this piles up yung pamamaga sa ilong, and eventually they can have problems in the ears, the throat, sinusitis, connected po lahat yun.
Okay.
So, see a
Ang
doctor.
pagsuot ng mask, Dr. Mari, ngayon halos everyone are still wearing masks. Could there be any problems with the nose with constant wearing of masks?
Actually, it's protection. It's really your protection. Some of those with allergic rhinitis have less attacks because they don't inhale the allergens as much because they're wearing masks. It shouldn't cause a problem, except of course if you're allergic to the mask.
Okay, so napaka-importante yun because a lot of people still prefer to use mask, which is now, as we know, still a good thing to be wearing our mask. How should people take care of their nose in general, Doc Mari?
Okay, well again, like the ear, it has a self-cleaning mechanism. So although we want it clean, Pilipino gustong-gusto malinis, don't clean too much. No? Wag yung may papasok ng malalim na cotton buds, again, deep inside the nose. Just blow gently, don't blow too forcefully. And please avoid using different medications or nasal sprays that are not approved. Marami kasing lumabas din sa market that might be causing more damage instead of good to the nose.
Okay, well, we'll talk about that a little bit more, but let's talk about a little bit about some possible trauma. Ang nosebleed, madalas ito nangyayari. It's very concerning for anyone who sees ang pagdudugo ng ilong. How should a nosebleed be treated or be approached, Dr. Man?
All right. So because the nose, very thin ang balat inside the nose, it can easily be damaged just by picking, especially if too much cleaning or too much blowing or pag very dry siya. So when it happens, very important, just pitch firmly right after the hard part of the nose, go down, and then the soft part, you pitch there. Forward the head a little bit, but not really bent over, and not looking up, because then the blood will go to the throat and the patient will cough. And just press for 5 minutes.
Okay.
Most of the time, that is the most common cause of bleeding from the front, and it will stop. But if it's really continuous, 20-30 minutes, a lot of blood, go to the emergency
Go
room.
to the emergency room for the control of that bleeders.
Yes.
Pag more than 10 to 15 minutes, at
Yes.
ayaw ng tumigil. Okay, you also mentioned how a lot of medications are now out in the market, nasal sprays for that matter, in order to maybe kill bacteria, kill virus, and all this. We'll talk about this after the break kung effective talaga ito. So stay with us here on MedTalk Health Talk. We'll be right back. Okay, in today's episode of ENT, we've been talking so far about our ears, and now we're still talking about our nose. So still with us is Dr. Mari Enucilia, who is an otorhinolaryngologist from St. Luke's Medical Center. Okay, Dr. Mari, now let's talk about the several medications nowadays, especially pagdating sa mga nasal sprays. Marami, lalo na nung dumang pandemic, a lot of nasal medications have come out that have claims of being able to protect us from viruses, bacteria, and all other things. So what's your opinion on this?
All right, so yes, there are lots of medications. Nasal sprays are pretty good because they work direct to the nose. You don't go to the rest of your body. So as ENTs, we use it a lot, like steroid sprays for allergic rhinitis, and they're pretty safe. But there are those that came out that didn't really undergo a lot of studies, and some of them use very strong chemicals, and they actually can damage the natural defenses in the nose. Instead of adding the protection, it removes the protection. So we just have to be very careful with what we select to put in our nose. The safest would just be a plain sodium chloride nasal spray, but everything else you might need to check with your ENT doctor.
Okay, very good advice there. Now from our nose, let's move on now to our throat. Paano ba konektado ang ating throat sa ating ears, sa ating nose?
All right, so we mentioned earlier, the inside part of your ear, there's a connection to the nose, the eustachian tube for balance of the air pressure, and the nose goes all the way to the back and down the throat. So they're really connected. Kaya ENT, hindi pwede pong maghiwalay yung ears, nose, and throat. So connected pa, what the nose is exposed to, usually the throat is also exposed to it.
Okay, and one of the more important things in our throat is our voice box, or kung saan naproproduce ang boses ng isang tao. Now let's talk about ways in which we can preserve our voice, take care of our voice para nandyan siya all the time.
So one is how we use our voice, especially for voice professionals like you. Nauso ang Zoom, online meetings, we have to project more with our voice kasi naka-off ang camera. Minsan nasistrain po, we're not using it properly or not good posture while speaking. All of those add strain to the voice and we overuse it. So dapat careful po tayo, we use it properly, and hydrate. Na nakakalimutan natin uminom ng tubig. Iba po ang soft drinks, iba po ang alcohol, iba ang coffee. We really need to hydrate because the skin in the vocal folds is very thin. So if it's dry, it can easily get damaged.
Okay. Now for those who use their voice as you said as part of their living, this is very important as well. Pero merong mga tao, Doc Mari, na kahit anong gawin nila, may paos ang boses nila. Is this something to be concerned about?
Yes, definitely. When you first get your paos or napaos po ang patient, usually voice rest. Or for example, if you have cough, you can expect that you might get a little bit of hoarseness from too much coughing. But if no more cough and you're not using your voice anymore, you're rested, and the hoarseness is there for more than 2 weeks, it's time to see the doctor because there could be something else wrong.
Okay, so moving on from our voice, let's talk about now yung ating liig. A lot of people might all of a sudden find something peculiar on their neck. Meron silang nakakapa, meron silang mga malilit na parang hole nararamdaman sa leeg nila. This could most likely be a lymph node or yung tinatawag na kulane. What should people be concerned about kapag meron silang nakakapang lymph node or kulane?
So yung kulane or lymph nodes, we have hundreds of these normally in our neck, but they're pretty small. And they're part of our defense again. So they react to anything that they recognize as an enemy. Okay, so when you have cough and colds, infection, pwedeng lalaki siya, sasakit siya, but usually within a few days, wala na. Again, if you have that infection, then see a doctor. But if it's something na lumalaki tuloy-tuloy, hindi masakit, more than 2 centimeters na, more than 2 weeks na, andun pa rin, it's really time to see your doctor because it could be something else also.
Okay, so part also na parte ng leeg na pwedeng makapa is actually our thyroid. So let's talk about that a little bit. Ano bang purpose ng thyroid natin at bakit pag sinubukan kong kapain yung thyroid ko, wala naman akong nakakapa?
Yes. So we all have a thyroid. That's one very important thing. It produces the hormones we need for metabolism. And medyo uso yung terms na hyper or hypothyroid kasi nga yung hormones for metabolism. But pwede ka rin po magka-problem na bukol sa thyroid kahit normal ang hormones, and that one will need to be evaluated kasi it could be something that will need to be treated kung lumalaki po. Normally, dapat hindi siya nga nakakapa like what you said.
So are there any food to avoid para mas maganda ang ating health with our thyroid or even with our nose or our ears?
Well, generally good, healthy diet, which is actually not easy nowadays. We try to maintain a good, healthy diet. Our salt is iodized already, so that addresses the problem of goiter due to iodine deficiency. Good, healthy diet also, well, yeah, vegetables are good, but sometimes we need to balance a little bit, sometimes with meat, because of the iron that's there, and the vitamins and the different fruits and vegetables. Wag lang po sana isang klaseng food type. And exercise, of course, getting out, vitamin D from sunlight. Takot lahat po tayong Pinoy magpa-araw, but we need that also to get natural vitamin D.
Okay, napakagandang information, Doc Mari. To wrap things up, do you have any message for our viewers, especially when it comes to the health of their ears, their nose, and their throat?
Okay, so first, let's trust our body. Our body's own natural cleaning mechanism, whether it's the ears, the nose. Sneezing once in a while is normal to clean the nose. Maybe hydrate, keep our nose healthy. Water is the best therapy. Exercise, proper diet. But in general, if a problem is lasting more than 3 to 5 days, you go see your doctor. If there's bukol na nakakapa or hoarseness more than 2 weeks, patingin na rin po sa doctor.
Okay, napakagandang information na yun talaga. So thank you so much, Dr. Mari, for sharing your information, your expertise for that matter, to our viewers about that. Always make sure that your ears, nose, and throat are properly taken care of, and always make sure that you have your lifestyle in check, stop any of those vices, and eat a balanced meal, and get that exercise in. I'm Dr. Freddy Gomez, and thank you for joining us here on MedTalk Health Talk.